Ever complained about long waiting times at the clinic or how awful modern medicine tastes? After watching this video, you will be kissing the ground outside any modern hospital. Imagine going to the doctor for a simple migraine and he pulls out a hand drill. Or maybe you have a stomachache and the prescription is a nice glass of mercury. Sounds like the script of a horror movie, right? For the people of the past, that was grim reality. Today, we are taking a journey into the darkest corners of medical history. I'm going to tell you about 20 procedures meant to heal, but which more often maimed or killed. We'll find out why doctors genuinely believed in the magic of bloodletting, and why they thought red-hot iron was the ultimate cure-all. These aren't just spooky stories. This is what our ancestors actually endured. Get ready. It's going to be painful, terrifying, but incredibly fascinating. Before we start our bloody countdown, let's understand one crucial thing. Doctors of the past weren't sadists. Well, most of them weren't. They truly wanted to help. The fundamental problem was that they had absolutely no clue how the human body worked. Before the microscope and germ theory, medicine was a bizarre mix of guesswork, religion, and astrology. For centuries, the dominant medical theory revolved around the idea of the four humours, or bodily fluids: blood, phlegm, yellow bile, and black bile. Doctors believed that illness struck when the balance of these fluids was disrupted. Too much blood, drain it. Too much bile, induce vomiting. The logic was ironclad, but deadly. Instruments were never sterilised, and anaesthesia simply didn't exist. Patients had to be held down by several strong orderlies, while the surgeon operated purely on speed. In this context, a patient surviving was often a true miracle. And now, we're going to look at 20 ways physicians tried to fix that balance. Let's start with a true classic of the genre, skull trepanation. It is one of the oldest surgical procedures in human history. Archaeologists have uncovered thousands-year-old skulls, featuring intentional, drilled holes. The process was brutally simple. A practitioner would take a sharp stone and later a specialised drill and bore an opening directly into the head of a living person. Why? The motivations varied. It was often believed that the procedure would release the evil spirits responsible for conditions like epilepsy or madness. Later, it was used to treat severe migraines or the lingering effects of trauma. The most astonishing part? Many patients actually survived the procedure. Evidence shows the bone tissue often healed around the opening. Now try to imagine that level of pain without anaesthesia. The patient would literally hear the grinding and scraping of their own skull bone. Yet the practitioners believed they were releasing either excess pressure or indeed literal demons. Today, trepanation is only performed by neurosurgeons as a life-saving measure in extreme circumstances. Back then, it was essentially considered a cure for a bad headache. Let's move on to number 2, bloodletting. This was arguably the most popular medical procedure for 2 millennia. Got a fever? Bleed the patient. Pneumonia? Bleed them. A broken leg? Why not try bloodletting for that too? Physicians genuinely believed that blood would stagnate and putrefy, thus requiring removal. To achieve this, they employed knives, lancets, and perhaps most notoriously, leeches. In the 19th century, Europe had a literal obsession with leeches, importing them by the millions. Sometimes doctors would drain litres of blood from a patient, often until they passed out. Fainting was actually considered a positive sign, indicating that the illness was finally receding. In reality, the patient's body was simply shutting down due to massive blood loss and exhaustion. The ultimate irony, bloodletting is what killed George Washington. His doctors attempted to treat a throat infection by draining nearly half of his total blood volume in a single day. The first president died not from his ailment, but from the cure. Let's pivot now to something more chemical, mercury. We know today that it's a deadly poison. In fact, most of us panic if we even break a household thermometer. However, centuries ago, mercury was the go-to treatment for syphilis. The disease itself was terrifying and disfiguring, and the medical response was equally brutal. Patients were slathered in toxic mercury ointments, forced to inhale mercury vapours, and occasionally even instructed to drink mercury compounds. This era gave rise to the chilling proverb, "A night with Venus and a lifetime with Mercury." The side effects were catastrophic. Patients suffered hair and tooth loss, kidney failure, neurological damage, and severe psychosis. This poisoning is famously referenced by the character of the Mad Hatter in Alice in Wonderland, whose erratic behaviour was a direct result of mercury poisoning sustained while treating felt for hat production. People were, quite literally, rotting alive, yet physicians of the time misinterpreted the profuse salivation caused by the mercury as a sign that the body was successfully purging the disease. Moving on. Coming in at number 4, the tobacco enema. Yes, you absolutely heard that correctly. In the 18th century, physicians were convinced that tobacco smoke possessed vitalizing, life-giving properties. To put this theory into practice, they invented specialized bellows designed to administer tobacco smoke directly into the rectum. This unusual technique was most commonly applied when attempting to revive drowning victims. The logic was truly bizarre. They believed the warmth and stimulation from the smoke would somehow kickstart respiration. This practice was so common that along the River Thames in London, you could actually find tobacco enema kits hanging up. Much like modern-day public access defibrillators, it was seen as cutting-edge emergency care. Needless to say, it failed spectacularly. Not only did it not work, but nicotine is a potent poison, and a dose administered this way could easily finish off someone who was already in critical condition. Fortunately, over time, doctors realised that good old mouth-to-mouth resuscitation worked far better than blowing smoke in from the wrong end. It brings us to one of the darkest chapters of the 20th century, the lobotomy. This surgical procedure was first developed by the Portuguese physician Egas Moniz, an achievement that even earned him the Nobel Prize. The method's core goal was to sever connections within the brain's frontal lobes. However, it was the American doctor, Walter Freeman, who truly turned it into an assembly line. For his specialized transorbital technique, Freeman employed a simple tool resembling an ice pick. He would insert this instrument through the patient's eye socket, puncture the thin bone behind it, and blindly maneuver the tool inside the brain. This quick procedure was utilized to treat everything from schizophrenia and severe depression to simple cases of bad behavior in teenagers. The entire surgery often took a mere 10 minutes. The result? The patient was often reduced to a vegetable. Their entire personality was effectively erased. Patients became compliant and quiet, but utterly hollow inside. Thousands of lives were destroyed before the world finally recognized this procedure for the barbarism it truly was. Our 6th remedy sounds like a plot twist straight out of an Indiana Jones movie. It's medicine made from mummies. Starting in the 12th century, there was an insatiable demand for Egyptian mummies across Europe. They were ground into a fine powder and sold in pharmacies. This powder, known historically as mumia, was prescribed for everything imaginable, from headaches to stomach ulcers. People were, quite literally, engaging in cannibalism by consuming the remains of ancient Egyptians. The demand became so massive that merchants began counterfeiting mummies, often using the bodies of recently deceased vagrants or executed criminals. They were dried in the sun and marketed as ancient relics. Wealthy aristocrats would drink this powder mixed with wine, convinced they were absorbing a mystical, vital force. This bizarre practice finally tapered off during the Age of Enlightenment, but the macabre idea of using corpses for medicine captivated imaginations for centuries. The 7th procedure might just make you appreciate the simple ability to speak. We're talking about the hemiglossectomy. That terrifying word means the partial removal of the tongue. Back in the 18th and 19th centuries, doctors hypothesized that stuttering was caused by the tongue simply being too large or somehow malfunctioning. Their solution? Cut off a piece, often without anesthesia. The surgeon would take a pair of scissors, or sometimes a scalpel, and simply slice away a portion of the tongue's muscle tissue. Blood would fountain everywhere, and the risk of fatal infection was immense. The worst part? It did absolutely nothing to cure stuttering. On the contrary, the patient frequently lost the ability to speak intelligibly at all, yet doctors continued to practice the procedure, often insisting they just needed to perfect their technique. If this stands as a stark example of brutal surgical intervention being applied to a problem that actually required modern speech therapy and psychological understanding, let's talk now about a drug that is strictly the domain of dealers today. Fact number 8, heroin as a cough medicine. In the late 19th century, the Bayer company launched a new miracle product. They named it heroin, derived from the German word for heroic, because patients allegedly felt like heroes after taking it. It was marketed as a safe alternative to morphine, and, get this, as a children's cough suppressant. Bottles of heroin could be found in almost every home. Mothers administered it to their children, hoping they would sleep better and stop coughing. Naturally, the children stopped coughing because heroin is highly effective at suppressing the respiratory center. The unintended side effect? They were becoming addicts. It took years for doctors to realize that their patients were becoming massively dependent on this safe syrup. Only after widespread addiction was apparent did authorities finally ban it. Get ready, because the 9th fact on our list might seriously gross you out. We're discussing urinotherapy in ancient Rome and the Middle Ages. The Romans strongly believed that urine was an excellent way to whiten teeth. And to be fair, the ammonia content in urine does actually bleach. Wealthy Roman women would specifically rinse their mouths with imported Portuguese urine, which was considered the highest quality and commanded a high price. Moving into the Middle Ages, urine was used to clean wounds and was even consumed as a supposed treatment during plague outbreaks. Alchemists often searched for the elusive philosopher's stone within urine samples. But perhaps the most shocking practice involves diagnosis. Physicians of the time would routinely diagnose patients by tasting their urine. If the sample tasted sweet, it indicated diabetes, a condition they aptly called honey urine. Just imagine the daily routine of a medieval doctor, mandatory taste testing of every single sample. Suddenly, modern whitening toothpaste seems like a genuine miracle of scientific progress. The 10th item on our list is the treatment of one deadly disease with another, malariotherapy. In the early 20th century, a diagnosis of syphilis was essentially a death sentence. The disease would destroy the brain, often causing progressive paralysis. Austrian physician Julius Wagner Jauregg noticed a crucial detail. Syphilis patients who had experienced a severe, sustained fever sometimes spontaneously recovered. His radical solution was to deliberately infect these patients with malaria. The extremely high temperatures caused by the malaria infection would essentially kill the syphilis bacteria, which are highly sensitive to heat. The patient would then be cured of the malaria using quinine. This was an incredibly risky procedure. Around 15% of patients actually died, not from syphilis, but from the malaria itself. But for the survivors, it was the only real chance they had to avoid succumbing to madness and death. This discovery, despite its brutality, earned Wagner Jauregg the Nobel Prize. Cruel? Absolutely. But before the age of antibiotics, this horrifying treatment was, terrifyingly, effective. Number 11. Pulmonary plombage. Before effective treatments for tuberculosis existed, doctors went to drastic extremes. The prevailing medical theory was that an infected lung needed complete rest to heal the deep cavities, the holes literally eaten away by the disease. To achieve this rest, doctors would surgically create a large pocket in the chest wall, then fill it with virtually anything available to compress the lung and force it to collapse. They used substances like fat, paraffin wax, surgical gauze, and, astonishingly, even everyday objects such as ping-pong balls or solid glass spheres. These foreign bodies often remained inside the patient for years. Unsurprisingly, they frequently caused gruesome infections, migrated into surrounding organs, or worked their way out through open fistulas. Patients lived, often struggling to breathe, with foreign objects embedded in their chests, desperately holding on to the hope of a cure. It was a truly desperate attempt to save people from the White Plague, which was claiming millions of lives worldwide. The 12th method we look at is inspired by the paintings of Hieronymus Bosch, the removal, of the Stone of Madness. During the Middle Ages, charlatans and travelling surgeons convinced the public that their mental illnesses, whether madness, depression, or simple stupidity, were caused by a literal stone lodged inside their skull. The procedure was performed publicly, often right in the town square. The so-called surgeon would make an incision on the patient's forehead, then use skillful sleight of hand to swiftly produce a pre-hidden pebble. The crowd would cheer, and the patient, head bandaged and bloody, genuinely believed they would now be cured of their intellectual failings. Naturally, there was no stone in the brain whatsoever. It was pure deception and the placebo effect, combined with the severe risk of dying from septic infection. Yet people paid good money for this operation, hoping for a simple, instant fix to their very complicated problems. The 13th point, cauterization. If you had a serious wound that required immediate blood stoppage, or if you were suffering from hemorrhoids, the doctors would prepare the iron. A piece of metal, often heated until it was glowing red, was pressed directly onto the living flesh. The blood would clot instantly, and the vessels would be sealed shut. However, the pain was hellish. It was excruciating. Patients often went into agonizing shock, and many died directly from the trauma induced by the pain. Physicians also used cauterization to treat mental illnesses. They would apply the searing iron to the back of the patient's skull in an attempt to awaken the brain. This was based on the old belief that fire possessed cleansing or purifying properties. Just try to imagine having hemorrhoids treated with a red-hot poker, or without anesthesia. It is no wonder that after procedures like this, many patients simply preferred not to admit they had any aches or pains whatsoever. Method number 14. Beauty requires sacrifice, literally. We're talking about arsenic. In the Victorian era, paleness was a sign of aristocracy. To achieve this noble complexion, women, and occasionally men, consumed arsenic. They had special arsenic wafers, pills, and ointments available. Arsenic did make the skin pale because it actively destroyed red blood cells. Essentially, this was slow suicide. The poison steadily accumulated in the body. Thyroid issues would begin, often resulting in goiter or a swollen neck. But even this was sometimes considered attractive. If a woman stopped taking arsenic, her face would break out in terrible blemishes and blotches. This meant she was essentially forced to continue consuming the poison until the day she died. It was a deadly fashion trap. Number 15. Rotational therapy. Back in the 19th century, Benjamin Rush, often called the father of American psychiatry, and his contemporaries, like Erasmus Darwin, Charles Darwin's grandfather, believed madness could be cured by simply spinning the patient rapidly. The individual was strapped into a special chair, either suspended from the ceiling or fixed to an axis, and rotated at speeds reaching up to 100 revolutions per minute. Patients would vomit, lose consciousness, and often bleed from their noses and ears. The doctors theorized that the centrifugal force would break up the stagnant blood, believed to be pooling in the brain. In reality, it was little more than outright torture, designed to terrify the unfortunate mentally ill into absolute submission. These terrifying rotating devices were utilized in psychiatric institutions for decades. Let's look at the 16th method, popular just a century ago, radioactive water. When Marie Curie discovered radium, the world went absolutely wild. People genuinely believed radiation was pure energy. Pharmacies started selling radium water, radium toothpaste, chocolate, and, believe it or not, even uranium-infused condoms. The most famous case involves the millionaire Eben Byers. He regularly drank Radithor, distilled water laced with radium, believing it would boost his vitality. Initially, he felt fantastic, but then his teeth began falling out, followed by his entire lower jaw simply deteriorating. He died a gruesome, painful death and had to be interred in a lead-lined coffin. For a long time, doctors simply couldn't believe that this magic light they worshipped was, in fact, deadly. The 17th way to lose weight will make you appreciate dieting and the gym. We are talking about tapeworms. In the early 1900s, newspaper advertisements promoted pills containing the eggs of the beef tapeworm. The headlines promised, Eat what you want and melt the weight away. A woman would swallow the capsule, the worm would hatch inside the gut, and immediately begin consuming the food instead of the host. Weight loss did occur, yes. However, the parasite could grow up to 30 feet long. It caused severe pain, nausea, and debilitating weakness. But the real nightmare began when it was time to extract it. The doctor would place a bowl of warm milk near the patient's mouth, hoping to lure the parasite out until it emerged from the throat, allowing them to grab it. Sometimes these massive worms caused suffocation. That was the gruesome price for a slim figure. Point number 18. Voronoff's method for rejuvenation. In the 1920s, surgeon Serge Voronoff promised men eternal youth and virility. His method? Transplanting monkey testicular tissue into humans. Wealthy older men from all over the world lined up. Voronoff even set up his own monkey farm. He would cut open the patient's scrotum and stitch in pieces of chimpanzee or baboon tissue. The effects were short-lived and were likely just due to the placebo effect. However, the consequences were very real. Tissue rejection, infection, and, according to one theory, this procedure is how HIV may have initially jumped from monkeys to humans. But Voronoff became a millionaire by successfully selling the dream of eternal youth. The 19th method concerned the youngest patients, gum lancing. Up until the early 20th century, teething itself was actually considered a deadly, life-threatening illness. Doctors blamed the emerging teeth for diarrhea, fever, and even convulsions in babies. To help the tooth emerge, physicians would take a lancet and slice the baby's gums straight down to the bone. Crucially, this was done without any anaesthetic. Naturally, infection was immediately introduced into these open wounds. Numerous children died of sepsis specifically because of this supposed assistance. Infant mortality rates during this period were already horrific, and doctors, using their unsterile instruments, made a substantial contribution to those deaths, all while genuinely believing they were saving a life. And now, for the 20th and final fact, the treatment for the wandering womb. Both ancient Greek and later medieval physicians were convinced the uterus was an independent, almost animalistic entity capable of roaming freely throughout a woman's body. If the uterus migrated toward the liver, it supposedly triggered hysteria. If it moved up to the throat, it caused choking or suffocation. To coax this beast back into place, doctors relied heavily on smells and odours. If the womb was believed to have ascended too high, the woman was forced to inhale foul, repulsive substances, such as burnt feathers or sulphur fumes, while pleasant aromas were applied near the groin to lure the organ downward. The treatment was reversed if the organ was too low. While this practice sounds utterly absurd today, the diagnosis of hysteria plagued women for centuries, often causing real physical ailments to be ignored entirely. Their condition was instead treated solely by the strategic application of appealing or disgusting scents. So, are you still worried about getting a simple shot today? The history of medicine is a long path of trial and error, tragically paved with countless victims. Every single one of these 20 procedures was once considered the absolute pinnacle of scientific achievement. The best minds of their time truly believed that drilling holes in skulls and drinking mercury was the right approach. This really teaches us one crucial lesson. Science never stands still. What seems perfectly normal to us today might cause our descendants 100 years from now to feel the exact same horror. They might look back at chemotherapy and see it as sheer barbarism. But fortunately, we live in the here and now, an age of anesthesia, antibiotics, and evidence-based medicine. Thank you so much for sticking with this gruesome list right to the very end. If you found this interesting, make sure you hit the like button and subscribe to the channel. We've got plenty more stories coming your way. Now, a quick question for you. Which one of these procedures absolutely shocked you the most? Let me know in the comments which procedure you would never agree to, even under threat of death. I'll see you in the next video.